to Ask the Patient Advocate podcast, where we will discuss all things related to navigating your health. I am Dr. Elena Borrelli, and I'm so excited to talk about such an important topic of private patient advocacy. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together. Welcome back to a new episode of Ask the Patient Advocate podcast. Today we're tackling a serious but important topic, medical errors. They happen to occur more often than many people realize, and the consequences can be absolutely devastating. But the good news is there are ways to catch them, and that's really what we're here to talk about and where a private patient advocate comes in. So to help us unpack this today, we're joined by our very own assistant patient advocate, Katelyn. For those of you that haven't met Katelyn yet, she is a physician associate with years of experience, including past work at Mayo Clinic and MinuteClinic, and now works alongside us at Pathway Patient Advocates as a private patient advocate to help us support our patients, clients, and their families. So welcome, Katelyn. How are you doing today?
Great. Thanks for having me.
Of course. So we've talked about this a lot. I think this is a lot of what we work on very often with our clients' cases throughout the day. But medical errors are, they occur a lot, unfortunately. And there's so much we can talk about regarding this. There has been continual push over the years for many healthcare initiatives that have been implemented to help reduce medical errors, yet we still see them far too often.
Yeah, we really do. It's really an unfortunate part of our healthcare system.
I agree. And, I guess maybe I should back up a little bit for our listeners. So to clarify, when we say medical errors, what exactly are we talking about?
That's a great question. Medical errors can mean a lot of things. It could be a delayed diagnosis, a misread test result, or even miscommunication between providers about what a patient needs. Medication error is a huge concern. These errors may seem like paperwork or communication issues, but they can actually delay treatment and impact patient outcomes in major ways, sometimes with catastrophic results.
It's truly scary, honestly. So let's talk about why these errors actually happen. How can so many errors occur? I mean, I know that's a question in many people's mind. And why do these errors happen so often in today's healthcare system? Like, I know, talking to some people, it's almost like, how come we haven't figured out a way to reduce these errors or prevent them? And it's not that easy. So, I think that's kind of something we have to address and talk about.
I would definitely agree. It's always good, I think, to have an extra eye, particularly in medication orders, because you can get those little dosing errors. And sometimes if that goes wrong, you could end up in the ER or even the hospital if you get severe side effects from taking too much or too little of your medication.
Absolutely. And that's exactly why a private patient advocate matters. So, Katelyn, let's talk about some things that we do as private patient advocates to help prevent these errors.
Sure. So we would mainly focus on three things. First, we're going to want to identify those errors, meaning we're going to review medical records, test results, and physician notes to catch inaccuracies or oversights. And then second, we're going to monitor that process. So we're going to make sure that follow-ups are scheduled, results aren't missed, and care plans stay on track. And then third, we're going to bridge those communication gaps. We're going to ensure that patients, families, and providers are on the same page, and this will help prevent misunderstandings that could lead to harm. So in short, while providers are balancing many responsibilities, a private patient advocate keeps their eyes solely on the patient's safety and best interests.
Very well said. I completely agree. So we have the time and ability to pay attention to small details and catch things that the fast-paced healthcare environment often doesn't. And, that's a huge benefit of having a private patient advocate. So, Katelyn, can you share an example of when we made a difference in catching an error? I know there's so many, but is any one specific come to mind to share?
Absolutely. I've seen cases where a critical imaging result was misread, and without someone double checking the records, the patient would have gone untreated for weeks longer. By reviewing those records and asking the right questions, we were able to bring it to the attention of the care team quickly. That kind of oversight can literally change the outcome for a patient.
Medical errors are one of the leading causes of death in the United States, which is completely shocking. There's many different statistics that support this. So, Katelyn, what do you think we should have our listeners take away from this conversation?
So I'd say this: don't assume the system will always catch everything for you. Be proactive. Request your medical records, review them, ask questions if something doesn't seem right, and don't be afraid to bring in an advocate if you're feeling overwhelmed. It's not about trusting your providers, it's about creating a safety net so nothing important gets missed.
Katelyn, thank you so much for joining me for this conversation today. We really discussed the critical importance of having someone watch over when you navigate your healthcare, watch over to help prevent errors in the complex medical system. Medical errors can, of course, happen, but they don't have to define your care. And if we catch them early enough, we can help prevent many catastrophic outcomes. Private patient advocacy is about making sure patients and families members have the tools, the voice, and the support to prevent mistakes from becoming tragedies. So if you'd like help reviewing your medical records or navigating the healthcare system, reach out to us at Pathway Patient Advocates. You don't have to do it alone, and let us help you. Thank you so much for listening, and have a great day. If you have a question for Ask the Patient Advocate, email advocate@pathwaypa.com. Managing your health and navigating the healthcare system is challenging, but it's a lot better when we go through it together.